Let me begin with something very important. Many healthy people think cholesterol only matters after a heart problem happens. They think, I feel fine, I'm healthy, I'm active, I'm not overweight. So maybe cholesterol is not something I need to worry about right now. But the truth is, lipid control matters most before symptoms appear, not after. Because cholesterol does not suddenly damage arteries in one day. It works slowly, quietly, year after year. And many people who eventually develop heart problem had no warning early on. They simply had silent plaque formation and exposure over time. That's why controlling lipids while someone is still healthy is one of the most powerful, smartest decision a person can make. And to understand how to control lipids correctly, we first need to understand what lipids really are. Well, lipids are fats. And when people hear the word cholesterol, they only think about one thing. But lipid biology is more complex. We usually look at LDL, HDL, triglyceride, non-HDL cholesterol, ApoB, and lipoprotein a. Each one tells part of the story. LDL is the main particle that drives plaque formation, while HDL helps with transportation of cholesterol. But higher HDL does not guarantee prevention or protection. Triglycerides reflect biology, metabolic health, while ApoB tells about number of particles, which is often more important than LDL alone. Lipoprotein a is reflecting inherited risk. So when we say lipid control, we are not just talking about one number. We're talking about understanding which particles are creating long-term arterial exposure. And once we understand that, the next question becomes, why does LDL matter so much even in healthy people? Well, LDL is the bad cholesterol. It is dangerous because it enters artery wall with no warning, silently. The person does not feel LDL entering the artery. No pain, no signal, no symptom. But every year of elevated LDL increases cumulative exposure. And arteries remember that exposure. A mildly elevated LDL for 1 year is different than mildly elevated LDL over 20 years. That's why age alone does not fully protect someone, because long-term exposure builds slowly. That's why a healthy 35-year-old with elevated LDL still deserves attention, even if no symptoms exist. Because prevention early is biologically more important than treatment late. And that's where lifestyle begins to matter deeply. The number one lifestyle changes will be food. Before medication, food is where lipid control starts. The biggest mistakes people make is focusing only on calories, but for lipids, quality matters more than calories alone. The first thing and the first target is saturated fat, because saturated fat directly raises LDL in many people. Major sources include butter, heavy cream, fatty red meat, processed meats, full fat cheese, and coconut oil in excess. That doesn't mean these foods should disappear completely, but frequency matters, portion matters, and daily repetition matters. Replacing saturated fat with healthier fats often lower LDL significantly. That means shifting towards olive oil, avocado, nuts, seeds, and fatty fish. And that simple replacement changes lipid biology over time. Number 2, fiber, especially soluble fiber. Well, fiber is very important because fiber can bind bile acid and helps remove cholesterol through the gut and prevent it from being absorbed. And the best sources of fiber, as you know, is oats, beans, lentil, vegetables, apples. And fibers, as I said, is very important. Many healthy people underestimate how powerful daily fiber becomes over months. Small daily fiber intake creates real LDL reduction over time. And unlike short-term dieting, fiber works quietly every day. Number 3 is sugar. Many people focus only on fat, but sugar, especially excessive sugar, can change lipids, especially triglyceride. Excessive sugar drives insulin spikes, increase liver fat production, higher triglyceride, and that's when even thin people can develop lipid problems if sugar intake is consistently high. Especially liquid sugar like soda, juice, coffee drinks, or frequent desserts. The liver converts excessive sugar into fat, and that changes lipid metabolism deeply. Number 4 is exercise. Exercise improves lipids in several ways. It lowers triglyceride, improves insulin sensitivity, and support HDL function, and helps visceral fat to shrink. And especially the visceral fat is a source of inflammation, so it's very important. But the key is consistency. A single hard workout does not work as repeated moderate activity over years. Walking daily matters, cycling matters, resistance training matters. The body responds to regular signals, not occasional extremes. Number 5 is weight loss. Well, weight loss is very important for lipid metabolism. Many people think that they need dramatic weight loss, but even 10-pound weight loss can change lipid biology, especially if visceral fat decreases. That lowers triglyceride, lowers insulin resistance, and decrease inflammatory burden, and the liver becomes more efficient in lipid handling. Remember that small changes matter biologically. Number 6 is sleep. Sleep can affect lipid metabolism indirectly. Poor sleep worsens lipid metabolism. Sleep deprivation increases cortisol, which is a stress hormone, insulin resistance, inflammation, and that indirectly worsens lipid metabolism. And sleep apnea especially increases the risk for cardiovascular disease. So lipid control is not only food, it is a full metabolic balance. Number 7 is stress. Stress can worsen lipids because it changes eating patterns, hormones, inflammation, and metabolism, and that affects cholesterol indirectly but powerfully. Stress often pushes poor food choices, poor sleep, higher blood pressure, higher inflammation, and over years, this matters. Okay, so when do you think healthy people will need medication, especially statins? Well, sometimes lifestyle is excellent, but LDL remains high. That usually means genetics is stronger, especially if LDL stays high despite discipline, family history is strong, and Lp(a) is elevated. In those cases, medication becomes prevention, not failure. There is a lot of people who are worried about using statins early on. But statins lower LDL safely in many preventive situations. Well, it reduces the cumulative artery exposure to LDL. That means lowers future plaque formation. And the goal is not medicine for everyone. The goal is matching biology to risk. What about the other ones that we talked about, like the ApoB and the Lp(a)? The ApoB, as we said, is the cholesterol burden. Sometimes LDL looks acceptable, but ApoB remains high. That means particle burden is still high. That means higher exposure to the arteries, and that means increased risk. While the ApoB(a) is inherited, is genetic, it can remain dangerous despite healthy lifestyle. Every healthy person should know it once because it changes prevention intensity forever. What about calcium score? Well, calcium score also plays a role. If risk is unclear, calcium score helps. It shows silent plaque directly. And sometimes healthy looking people already have calcifications. And that changes urgency. So what a realistic healthy lipid plan looks like? Well, a practical plan is check full lipid panel. No ApoB, Lp(a), reduce saturated fat, increase fiber, sleep well, exercise consistently, control weight, and repeat labs. Consistency beats perfection. Here's my final message. The goal is not obsession. The goal is long-term quiet protection. Because arteries age every day and lipids shape that aging. A healthy person does not wait for symptoms. A healthy person protects future arteries right now. If this helped you understand lipids better, please subscribe. Thank you for trusting Dr. Noni's Power Lab. See you next time. Have a great day. Bye-bye.